Hello and welcome back to Dr. Carri's Clinical Corner. And today we're going to talk about urinary frequency in men specifically. So in men, it usually relates to the prostate and not so much a muscle function. In women, often if they're going to the bathroom too often, it's muscle tightness, muscle weakness of the pelvic floor, bad habits, things like that. But in men, it most often is due to prostate hypertrophy, an enlarged prostate. So they call this medically BPH, benign prostate hypertrophy, meaning benign meaning it's not cancerous, but the prostate is growing. So this is super common in men as they age, like over the age of 50, it starts to grow. And so men start having to go to the bathroom more often. So let me show you this anatomy picture. So this is by a company called Duvet Days. I have a lot of their artwork. It's beautiful. It's anatomically correct, but also a little artsy. So here's the bladder and here's the prostate. So these sit right on top of each other. And sometimes they're like kind of enmeshed together. And so what happens if this prostate gland starts to get bigger, it pushes on the bladder. And so what I tell my female patients is that when the pelvic floor muscles are tight, so let me show you in females, it's the opposite. So in females, here's the bladder and here's the uterus. And it's opposite. So in females, the pelvic floor muscles are here. And so in females, often if the muscles are tight, they push on the bladder and they make you feel like you have to go pee more often. So we can work on making the muscles less tight. But in males, it's the opposite. So the bladder is on top of the prostate. So over time, with age, the prostate gets bigger and it pushes on the bladder. So two things, it makes the bladder not be able to like expand as much and hold as much urine, and that constant pressure on it gives a signal like, oh, I need to go to the bathroom. So there's not a whole lot pelvic floor therapy can do about that because it's an anatomical, like physiological thing. It's not really muscles. You can work on your bladder habits a little bit. We can see if there's any muscle tightness, but generally it's an anatomical thing, an anatomical change that's happening. So that's usually why men have to go to the bathroom more often as they age.